You may have a favorite restaurant or even a regular mechanic, but there may be no business relationship more valued than a long-standing partnership with a trusted doctor. Now, a staggering number of older Americans are discovering that their longtime doctors are being dumped from their insurance plans, and that leaves them with some difficult and expensive choices to make. CNN's Chris Freites is with our investigations unit. He joins us live from Washington. Tell us more.
So, Carol, what we're learning is that because Obamacare makes it tougher for insurance companies to drop their patients, that instead it appears that now they're dropping the doctors, and that's hurting thousands of patients across the country in at least a dozen states.
I'm decorating and I'm making the curtains up there.
Jody Sabatino is like many seniors. She sees multiple doctors and takes lots and lots of medication.
How many prescriptions do we have here?
Okay, 1, 2, 3, 4, 5, 6.
Last month, the 79-year-old got some jaw-dropping news. Her insurance company, United Healthcare, is cutting 4 of her 6 physicians from its Medicare Advantage plan, including her most trusted doctor, Dr. Lawrence Michkowski, or Dr. Mitch to patients like Jody. The cardiometabolic specialist will be unceremoniously dumped from United's Medicare Advantage network January 1st with little explanation. Or, as United put it in a letter,
United Healthcare is amending your agreement referenced above to discontinue your participation in the Medicare Advantage network. This amendment does not require your signature.
But the doctor thinks United is trimming physicians from its network because under Obamacare, it's harder to drop patients.
Let those high-cost patients move out of the United Healthcare Medicare Advantage plan over to Anthem or Humana and let those poor suckers, so to speak, pick up the cost.
United's decision left Jody and her 94-year-old husband, Nick, facing a tough choice. Do they stay with United and find new doctors, or try to keep their doctors by finding a new insurance plan?
Dr. Michkowski has been my doctor for 20 years. No one knows me any better than he does, and it's silly not to continue to go with him.
So Jody went shopping.
This was expensive, this was expensive.
And the plan she bought is going to cost her much more.
Do you have any sense of how much more that will end up costing you?
These will be double.
Jody and Michkowski are not alone. The American Medical Association says United and other insurers have taken similar action in at least a dozen states. In Connecticut, for example, United cut about 20% of its doctors, according to the State Medical Society. And here in Ohio, the insurance giant dropped hundreds of doctors, affecting thousands of patients.
The patient costs a lot, and United is going to those patients' doctors and dropping them, and therefore getting rid of the patient.
United concedes it is reducing the size of its network, but declined an on-camera interview request. In a statement to CNN, United said, "Many health plans are making changes to their networks to improve quality and keep health insurance affordable. These changes are necessary to meet rising quality standards in an era of Medicare funding cuts." The insurance industry trade group argues that the changes are a direct result of Obamacare. To help pay for health care reform, lawmakers included $200 billion in cuts to the Medicare Advantage program and a new tax on health insurers.
Washington can't cut and tax the Medicare Advantage program this much and not expect seniors in the program to be harmed.
Even though Jody Sabatino was able to find a plan that included Dr. Mitch, she is still going to lose 2 other doctors.
We're walking away from people that we've known and trusted and counted on for over 10 years, and that's hard.